was a day of loss to the people of Toronto, capital city of Ontario, in 2008. It is commemorated as death anniversary of Dr. Sheela Basrur, who came into spotlight during SARS outbreak in Ontario in 2003. SARS, severe acute respiratory syndrome, a serious form of viral pneumonia, first identified in 2002 in China, affected 8,000 people, causing death of 200 across the globe. This outbreak terrorized Toronto as they lacked expertise voice to educate people on the virus. She was born to Indian parents Vasant Basrur and Parvati Basrur. Sheela attained Doctor of Medicine from University of Toronto. In 1998, she took charge as medical officer in Toronto. She took control of the worst disaster caused by SARS by getting out to connect with people to fight the outbreak. Strategic meetings, timely intervention, strict quarantines was implemented under the guidance of Sheela, which limited the death to 44 in Ontario. Neglected public health of Ontario was reorganized by Sheela, making her a prominent figure as a noble being and a model medical officer. The strong-headed woman died at 51, fighting a rare form of cancer, leaving behind her 14-year-old daughter. SARS was contained in 2004, which recorded again as COVID-19, which continues to cause deaths globally. COVID-19, identified in China on December 2019, has killed 382,368 people and has affected 64,73,000 people today. COVID-19 has far better testing options compared to SARS epidemic of 2003. India's strategic management of enforcing lockdown and timely social distancing to fight off novel virus gained them the title Frontline Heroes. Kerala reported first case of virus in India on January, which later rose to 300 in the month of April. Kerala model of COVID resistance seemed effective than other countries. Kerala's Health Minister K.K. Shailaja's foresight in preparing the state to combat the pandemic gained attention internationally. Her experience in dealing with the Nipah virus in 2018 in Kerala rose her confidence in fighting this epidemic. Though the number of positive cases is 1,412, the state believes that strict measures have paid off well. When it was just one Sheela in Ontario, there are a number of doctors, nurses, and officials today to educate and support the citizens globally from this health disaster.